as patients are looking for engagement, they want solutions that are meaningful to them, are connected to their doctor. So, we are positioned extremely well. We built architecture from the ground up almost a year and a half ago to really focus on patient engagement and allowing them to aggregate their data into a single repository and then share that with physicians, loved ones, or whoever that may be. So, that trend is something that is going very well for us. We've been positioned for it for some time, and the lining of the planets with these different trends is really good for us as a whole. It was us taking the time to build a national infrastructure to create a personal health record that is truly tethered to EMRs. A lot of organizations, their products came from either a practice management system, we're going to put a portal on top of that, or an EMR. There are very few companies that had the time or the focus to create a national infrastructure, to support the trends that are coming into play right now. We built translation services. So what translation services are is the ability to take different EMR nomenclatures, bring that into a common nomenclature, and then present that to the patient. Then having the ability to take that information and interject it back down into the physician workflows. Secondly is the patient access solutions that we have in place. We're really focused on engaging the patient to be more proactive in their healthcare. So having solutions that we can go into the patient's home, do monitoring in that environment, allow that information flow to their personal health record, as well as back to their physician, is something very unique in the industry right now. One of the new products that we've brought to market with HIMSS is our home health and wellness component. And what's really exciting about it is that with the platform we have in place is that we can plug multiple devices into the patient's home. And some examples that we used is that a physician can order physical therapy directly from their EMR. We pick that up into our system and then deliver that directly into an Xbox at a patient's home. The patient can perform physical therapy. The Xbox is monitoring their heart rate, whether they're doing those exercises correctly, and they can report that information back from a compliance standpoint and how I'm doing from my exercises to the physician or those care teams. And where we've taken that a step further is that we've added a monitoring and compliance component on top of our cloud-based infrastructure. So now a physician can order, I want you to take your blood pressure every day for 2 weeks. I want you to monitor your weight. I want your glucose. And we have devices now connected at the home that can automatically wirelessly upload that information into the personal health record, which is then picked up by monitoring compliance. So if you go out of range or you're not compliant, then the system will automatically notify the care team or the physician back in their standard workflows. So tying Xbox, tying these new devices, whether it's Withings or whatever it may be, into a single platform where that information can seamlessly flow between the patient and the provider is extremely powerful. We look at the Xbox as a platform that can do multiple things within the home. So monitoring of patients, doing physical therapy, those components can be used by any age group. And there are home health organizations that are already looking at, can we implement those platforms into people's homes to provide that feedback. So it's a very intuitive, no controllers, it's very intuitive for young to old. So with the Jardogs platform, we're aggregating data across the nation with the patient. So at a national level, you can look at populations as well as within communities. So if you look at the trend with ACOs that are going on out there, so one, we know bundle payments would be coming. Two is that I have to provide proactive health. And so the problem that everyone is facing is that within those ACOs, in most cases, you have multiple vendors within that solution. So it's very difficult to take your hospital systems, your clinic system, your single specialty solutions, and bring those into a single platform where I can do population management. Because I've got to bring that data together, I got to normalize it, I got to come up with a common nomenclature, and then I've got to figure out what tools can I put on top of it to even do population management. So let's say you accomplish all of that and you create that tool, but then after I identify that population, how can I affect change back into the physician workflow to actually make it actionable? So yeah, I can identify them, but what's the process across all these different systems to get them scheduled, to get those labs ordered, to change their medications? That doesn't exist in today's world, but it's a critical component into managing an ACO. So with the Jardogs infrastructure, since we have that connectivity and we have the ability to aggregate that, we've created a population management solution where we can look at the population, create those care plans, and then drive those actionable items back out to the physicians.